My topic was on mindfulness, meditation, and bipolar disorder. So, mindfulness meditation is basically becoming more aware of your thoughts and emotions. It's a practice that you can do day in and day out to kind of just recenter yourself about what's going on in your life and being able to be present in the current moment. So, for example, right now I would be able to use mindfulness meditation before creating this video to kind of just focus and center. That way when I create this video, I can be more aware of like my reactions, what I'm speaking on, and what I'm actually trying to get across in my message. Bipolar disorder, there's 4 different types. There's cyclothymic bipolar disorder, there is bipolar 1, bipolar 2, and then there is also bipolar disorder where it's not really specified. There's not enough symptoms to diagnose it as one or another. Bipolar 1 disorder is more severe. It's mania and depressive episodes, whereas bipolar 2 is hypomania, which is a shorter version of what bipolar 1 would be. So basically your symptoms are there, but they're not as severe. So you might be more agitated or more hyper, more quick to do things impulsive, but not the way that you would be in mania. People who leave certain episodes untreated, whether it be they're not following therapy or medications, they can become manic, or their depressive episodes can last longer. Cyclothymic is when you have depression for 2 years or 1 year in a child or adolescent. Same thing for hypomanic state. They also don't experience manic. Manic is more specific to bipolar 1, and that's why it defines what it is. And with cyclothymic, you see the symptoms, but not as severe. And again, it's over a longer period of time, whereas in bipolar 1, it may last 7 days. Bipolar 2, it can kind of range from that 4-day to 7-day. But again, it doesn't need to be there all the time. So even when those symptoms are not there, bipolar disorder is still there. You just may not be experiencing anything in that moment. Bipolar 1, you can experience mixed emotions, but not to the same ways that you would in bipolar 2. Bipolar 2 again would be less extreme, and bipolar 1 would be more extreme. So you can feel that depression and that mania at the same time, and you can experience hypomania and depression at the same time, but at a less severe rate. Cyclothymic, you actually don't experience it at the same time, because again, it's that longer time frame. And with the 4th type, which is unspecified, you don't really experience it the way you would with those other types, because they're not in there enough to be distinguished, or they're not there enough to be distinguished or to say like this is this or this is that. They kind of come in and out. Mindfulness meditation is definitely helpful for those who experience bipolar disorder, because they are able to become more aware of the emotions that they're feeling. With bipolar, it's kind of hard to say, like when you're in a hypomanic state, you may not even know it, but other people around you can definitely see what's going on because you're changing. It's that mood shift. Or even with depression, you might notice it, but other people might notice it to a different extent. They may not see how deep the depression is. And being able to practice that mindful meditation, you see how you can react to different situations, or when you see those depressive thoughts, you can actually go ahead and break that negative thought process, which can definitely save you in the long run, because the more you're able to control the negative thoughts or the depressive thoughts, the quicker your episode might be, or you might be able to avoid it altogether, which is super important, because you never want to be in those states. Like, let's say this is hypomania or mania, and this is the depressive episode. You kind of just want to be somewhere in between, because it's definitely going to be a lot more comfortable for the person experiencing those symptoms. You actually are able to gain control of your symptoms that way, because if you're in hypomania, your thoughts are racing and you're kind of thinking about one too many things at the same time. Or depression, you're not really thinking about anything but that emotion of sadness and whatever. So being able to practice this can help shorten the amount of time that you're sad, or that you're experiencing those deeper emotions that you can't really explain to yourself or to others. In the hypomania, you're able to slow down and you're able to think, okay, this is what's going on. This is how I'm going to conquer my impulsiveness, or this is how I'm going to conquer talking too fast or thinking too much. And that's definitely why this is considered one of the best therapies in conjunction with others. Some people do need medication. Some people need different kind of therapies, one-on-one or group therapy. But mindfulness meditation over cognitive behavior is definitely the number one, one of the number one treatments for people with bipolar disorder, because they're able to just gain control of their life in that way. It was really important for me to kind of learn about this, because mental illness is definitely not as talked about as it should be, and everyone's quick to be like, all right, put them on medication and then that's it. When participating in different kinds of things will definitely have a better outcome, because you're not just going to be like relying on that medication, but you're going to have the tools to gain control over what you think and what you feel and how you react to certain situations. And that's how mindfulness meditation can definitely benefit patients with bipolar disorder.